Thank you again to those who have joined us today for today's roundtable. Again, today's roundtable is focused on the role of telehealth in the future of excellent healthcare for rural areas. I'm pleased to be joined by Bill Gassen, President and CEO of Sanford Health, and Dedi, CEO and co-founder at TytoCare. I'm excited to be moderating today's roundtable. My name is Emily Heineman. I am a Senior Enterprise Account Manager at TytoCare, where we are transforming virtual care through our FDA-approved remote examination and diagnostic solutions that enable patients to seamlessly connect with clinicians wherever they are, whether that's at home, the school, the community clinic, even the workplace, and complete a comprehensive telehealth visit with remote physical exams. To set the context for today's roundtable, health systems across the United States are investing in a continuous effort to provide high-quality healthcare across the regions they serve. This can be challenging when dealing with communities in rural areas where the current shortage of clinicians adds to existing difficulties in making healthcare hard to access. As health systems strive to provide affordable and comprehensive access to care for their patient population, telehealth is taking a significant role in creating models for seamless care for people no matter where they live. In this discussion, we'll be speaking with Bill Gassen, President and CEO of Sanford Health, one of the leading health systems in the country. More than 2/3 of the communities served by Sanford Health are rural. Mr. Gassen will be joined by Dedi, CEO and co-founder of TytoCare, for a discussion about the unique challenges and opportunities for healthcare organizations working to provide convenient, high-quality care for rural and underserved populations. We will hear insights from our two leaders on the role of telehealth in the future of rural care delivery. Bill took over the role of President and CEO of Sanford Health in November 2020. In early 2022, he announced that Sanford Health's strategic position and aspirational goal is to be the premier rural health system in the U.S., ensuring that one zip code does not limit the care they receive. We very much appreciate you being here today, Bill. Dedi co-founded TytoCare 10 years ago and has since led the launch and establishment of TytoCare as a major player in the telehealth market. TytoCare now works with nearly 200 major healthcare players across the world. Thank you for joining us, Dedi, as well. And with that, we will dive into the roundtable discussion. Bill, I'd like to turn it to you for the first question, and thank you again for being with us today. Sanford Health is a leading healthcare system with a huge rural population. You've been taking massive steps to strengthen healthcare in rural areas and improve access to care. Please start by giving us background on Sanford Health.
Well, thank you, Emily. I'm grateful for the opportunity, the privilege to be with you today, and really to be able to participate and to contribute to this critically important topic. Dedi, it's a pleasure to be sharing this moment with you as well, too, and I'm grateful for the partnership and really looking forward to our conversation today. Emily, as you noted, at Sanford Health, a large contingency of the nearly 1.5 million patients who we have the privilege of serving today come to us through rural communities. And those communities are communities as defined by the Health and Human Services as being 50,000 or fewer in any given community. And so it makes up a big part of what we do at Sanford Health. It's helping to drive the mission, and it's really at the core of who we are at this organization. As you know well, and as many people who are alongside with us in this mission and seeking to serve those individuals and those communities know very well that in rural communities, many of the challenges they face or that we see faced across the healthcare industry are oftentimes more pronounced. They have some very unique challenges around access, which we know is one of the main drivers for the determinant of health outcomes. And those are one of the areas that we're really focused on right now at Sanford Health. In many of the rural communities across the United States, we know that those oftentimes find themselves in a more challenged position from an income perspective. And so just at home for us in Sioux Falls, South Dakota, where we're headquartered, we unfortunately are home to 5 of the top 25 poorest counties in the United States of America. Furtherly unfortunate is the fact that Buffalo County is the poorest county in the United States, and that's here in South Dakota as well. And so what that means is we have a lot of work to do. We need to make certain that we're doing everything we possibly can to be able to meet those needs. And at Sanford Health, we recognize that the way in which those challenges can manifest themselves is, in addition to poverty, it's food insecurities. We know that they have a higher incidence of, chronic disease. And so with that, we've got a heavy task in front of us, but we believe that we're well positioned to do that. At Sanford Health, just a little background on the organization, we're comprised today of 47 medical centers. In addition to that, we're blessed to have 2,800 very talented, highly skilled and devoted physicians and advanced practice providers. We have 170 clinical investigators and research scientists as well. And in addition to that, we also have over 200 senior care facilities under the Good Samaritan Society name. And then lastly, we have the opportunity and the privilege to provide care across the globe in 8 different countries as a part of our World Clinics initiative as well.
Thank you for that background, Bill. I'd like to now have you both speak to the biggest challenges facing rural healthcare from your experience. Bill, we'll have you respond first to this one. Can you speak about, where do you see the biggest challenges facing rural healthcare in 2022?
Yeah, thanks, Emily. It's for those who, again, are in the industry, those top challenges are going to sound pretty familiar. They're not necessarily unique to rural healthcare. However, we believe and we see day in and day out that they're oftentimes much more pronounced. And so those top challenges that we see and those issues that we have to face day in and day out really are around sustainability. They're around health equity and access. And with respect to sustainability, we know that the industry is seeing some very unique challenges that are compounding even some of those more historical. And one of the major challenges that we face today in healthcare, especially in rural America, is access to a sustainable workforce, those caregivers who are at the core of what we do. And as we're going to spend time today talking about the amazing advantages that we have through telemedicine, the incredible advancements in digital health, we still also know at the end of the day, those are really intended to augment the incredible care that's provided by those well-trained, highly devoted caregivers, those providers, those physicians, those advanced practice providers. And it's becoming increasingly challenging to find and to sustain that workforce in some of the rural communities. And historically at Sanford, we've spent decades competing against the traditional competitors for that right workforce. But in addition to that, over the sort of growing years, we found ourselves, as the world became smaller in some ways, also competing now really across the country in the healthcare space to find that right talent. And now, especially in the last few years, we've seen so much acceleration in that space that now we really find ourselves competing for talent agnostic to the industry. And those challenges faced with some of the smaller populations, the challenges around making certain that we can recruit and retain physicians into these communities creates a very challenging dynamic for sustainability. And so that's one of the areas that I think is even more pronounced when it comes to how do we deliver care and how do we do so in a sustainable way in the future for rural. Relative to health equity, as we talked about before, we see a number of these challenges that are most pronounced in rural communities. So here, especially across the upper Midwest, when we talk about some of the demographics and what that looks like, we know that oftentimes these communities end up finding more and more individuals who are living either just above, right at, or even below that poverty line. And we know that when that happens, we start running into not just healthcare challenges, but we also start to run into other challenges around just access to good, healthy, sustainable foods, the ability or sometimes the inability to be able to properly manage some of those chronic diseases. And so that creates some additional challenges there. And access is the most significant one. And especially that's the one that we see day in and day out. And so that's why you can't have a list that has your top challenges that doesn't talk about access. And we're excited about the ways in which to date Telemedicine has really helped us start to bridge that gap. I'm increasingly more excited about what the future of this digital transformation and what that's going to mean to allow us to further bridge that gap, to begin to close down on some of those access challenges that we have. But they're real. As we know well in rural America, we have challenges around broadband access that can create some of those issues. It's not only the types of things that we'll be talking about today, but making certain that we can extend that provider expertise so that we make good on a promise that we at Sanford Health believe that we're going to be able to accomplish, and that's to ensure that world-class care, not care just isn't good enough. It has to be world-class care, because we believe that the lives that are living in rural America are every bit as important as those lives that are living in some of those more densely populated urban areas. So in order to do that, we have to be able to solve for those access challenges. And we believe that the advancements in digital are really going to allow us to do that in new ways that we don't even probably know and can't even imagine today as we look ahead to the next 5 and 10 years.
Thank you, Bill. And Dedi, I would love to hear from your perspective and experience working with healthcare organizations across the globe. Would great to hear your take on where you see the biggest challenges facing rural healthcare.
Sure. Thank you, Emily. And again, Bill, great to be with you and to join this panel. Before I start, maybe a few words on TytoCare just to set the context. As Emily mentioned, Tyto provides first of a kind digital solution and tools to really replicate the face-to-face interaction and shifting it completely as much as we can in a very high quality medical level to the home. You can imagine it as a mini clinic at the home that we can support both general population for urgent care, primary care use cases, and also longitudinal care for chronic patient, post-discharge, and more than that. Generally, we have two solutions that fits the rural population and any population in that regards. One is at the community level, which is Tyto Pro and Tyto Clinic, where we really bring affordable and high quality care in a hub and spoke model, if you may, to communities, whether they are schools, visiting nurses, remote clinics, employer work site, and so forth, and also to the home itself, again, for general families and to chronic patients. Going into the rural side, we are mainly active in the US. We have about 700,000 patients today on the platform, 750, and about 11,000 clinicians using the system. And we do a lot of work with Sanford and with rural care, again, mostly in the US, but also outside. We work in New Zealand, in Chile, in Brazil, in South Africa. And the most relevant issues that we see that needs to be fixed, and I must echo what Bill mentioned, are around the shortage of clinicians, which is actually impacting the access to quality of care, as well as the health equity. And those solutions that we provide with partners like Sanford allows people that are remote from care, that don't have enough access or have equity status, health equity issues related, to get proper high quality care. So in the US, a lot of work with Medicaid, when we really allow both young moms and chronic patients to get proper care at home. We get into schools. In over 1,000 schools in the US are being used by Tyto, and globally we do the same use cases of remote clinics and visiting nurses in most part.
Today, and hearing those challenges that you both just described around sustainability, health equity, I'd like to get into some of the initiatives to address those challenges. So, Sanford has made massive efforts to combat some of these rural healthcare challenges, including the 350 million virtual care initiative. So, Bill, I would love if you could tell us more about this initiative and how it will impact the rural communities that you serve.
Yeah, thank you very much. As you mentioned, we're really excited at Sanford Health that in addition to all the work that we've been able to do over the years and what telemedicine has been able to do for us, allowing us to reach the nearly 1.5 million patients who we have today that span over 250,000 square miles. And we've been able to do that through a lot of the traditional telemedicine modalities that we're aware of and have used. And over time, that's allowed us actually to save our patients, as we've been able to calculate that out, over 20 million miles of travel. And we know here that that's not just about a time inconvenience. We understand those especially who are at the point of care, what that really means. It's not just the inconvenience of putting somebody in a vehicle and traveling for a few hours, but we know that this means for families, that it's people taking time off from work. We know that it means a significant disruption to school for children. We understand that especially for those who are at below or near that poverty line, what that means for them as well. That's a significant financial barrier as well. And it's not just getting there, but what do you do once you're there? And so what we've tried to do over time, and really what we look to in the future, is really dialing in and making sure that we're able to deliver the right care at the right time in the right place for the right people. And one of the ways that we're excited that we're going to be able to do that much better and much more sustainable into the future is through the virtual care initiative, our virtual care center that, as you stated, is part of a $350 million philanthropic investment. And I'd always be remiss as we talk about this if I didn't acknowledge and give thanks to Mr. Dedi Sanford, who is our benefactor namesake here at the organization at Sanford Health, who sought fit to invest $350 million of his own money into this initiative. And what mattered most to him, what captivated his attention and his philanthropy is exactly what we're talking about today. It's knowing and understanding that with the right investments and the right technology, we have everything we need to be able to stand in the gap to ensure that those who live in rural America have access to world-class care. And as we continue to improve, as we continue to advance and mature that, we know that it's not just in rural America. This is also going to be able to provide incredible access to care to other larger, more urban communities as well. And then not just here in the US, but as you heard Dedi talk about, that's going to have a major impact across the globe. And we're excited about what that means. We're excited to be a part of that. But this is something that we are actually launching just here in August is actually when we will break ground. We're going to break ground on this state-of-the-art facility here in Sioux Falls, South Dakota. And it won't just be a facility that we have here, but there's massive investment as well in the digital infrastructure, into the program, into the talent that's going to be needed to be able to do that. And at this virtual care center, patients won't come to this center, but physicians, providers, nurses, technicians will be here at the center, and they will access through technology those who they're providing care for across our footprint and beyond as we look forward. This is going to be an incredible facility for training as well. One of the things that we believe in that it's very, very important for us if we're going to make good on our commitments and our promises to deliver care to those who have come to us in their time of need, we've got to make sure we're training the next generation. And we're going to be able to do that through our residency programs, through our fellowship programs, through nurse training programs. And they're going to be able to do all of that there inside that facility. And so it will be a premier training ground that not only attracts, but allows us to retain and ensure that the next generation of caregivers are well prepared to deliver the right type of care that they need to at that point in time. And so very, very excited about what that looks like, excited about what that means to give us new opportunities to partner with industry experts like we're talking about here with Dedi. It's going to be, we believe, a very fertile environment for industry to want to come in to say, we want to partner with you, Sanford Health. We want to come together with a common vision of being able to meet that need and delivering care to those individuals who are in our care continuum today and those who are outside of it, to make certain that, again, one zip code does not limit the level of care that they receive. We're excited about what that investment also means from a thought leadership perspective. And what I mean by that is it's not just the hard work that has to be done on figuring out how to provide that care in a sustainable way, but it's also making sure that we're doing our part to push industry, to inform industry, to be able to push our lawmakers and to push that industry as well, to make certain that we have everything that we need, that we have an environment that's open and ready for us to be able to deliver that type of care. And so I'm also excited to announce that on August 23rd here in Sioux Falls, South Dakota, we're actually going to be leading and launching our summit on the future of rural healthcare. And at Sanford Health, we're excited to be leading that. We're excited to be hosting industry experts. We're excited to be hosting lawmakers and those people who we believe are in a position to shape the future of rural medicine, to be able to shape the future of telemedicine for generations to come. And so we're excited about that opportunity and what that means. And most importantly, everything that we do is aimed at making sure that we can improve the lives of the patients who we care for today, to be able to meet the needs of the communities that we care for. And so we're excited about what that opportunity means for us.
Thank you so much for sharing more about that. And it sounds like you have a busy month, but exciting month ahead of you. So thank you for sharing more about that initiative. It sounds extremely exciting.
Thank you.
And with that, I want to turn it over to you, Bill. I'll ask for both perspectives, Bill and Dedi, but I'll start with you first, Bill. As Sanford has experience providing remote healthcare solutions for over 10 years now, I would love if you could talk to us about how technology, as well as how behavior and attitudes have changed over time and how that's impacted your virtual care strategy. And if you could speak to this more from the provider perspective to start.
Yeah, exactly. Thanks, Emily. And we've been about this business like so many have in the industry of really leveraging technology to a way in which we can reach a greater number of the population, that we can bring care, we can bring specialty and subspecialty care to those patients who we have the privilege of serving. And we've been able to do that over time. But there are a number of challenges that we face day in and day out on that. And so, as we talked about before, a lot of these rural communities are challenged with access to sustainable bandwidth. And we need to make sure that we're doing the things that we can there to advocate for that, to help partner privately and publicly to make sure that we're able to meet some of those needs as well. And so as we look at that, that's one thing that's we've been about for quite some time, but it's picked up some ground lately. And I think a lot of that's due, as many of us know, that is extremely unfortunate of all the challenges that we've faced across this country and across this world through the pandemic, all the challenges that COVID has thrown at us. One thing that it has also done, and really is a necessary mode to be able to meet the needs of people, is it's really served as a catalyst, both on the provider side and the patient side, for accessing and adopting those digital opportunities, the telehealth opportunities to be able to meet with and connect with, in many instances, as we know, because it was the only way for individuals to access care. And so we have seen that really serve as a major catalyst for us. And I personally believe that that's moved us forward 5, 10 or more years in that adoption phase. And so now it's incumbent upon us with that momentum to make sure that we capitalize on that. And as we've looked at that, we've seen what that's done for us here at Sanford Health. I mean, we've got a few real material examples. And so our endocrinology practice in Fargo, North Dakota now sees almost exclusively their patients through virtual methods. And really what that means is, again, if you think about a patient who would otherwise travel a few hundred miles to come in for a 15-minute appointment, now doesn't have to do that. We're avoiding the burden, the interruption to their personal, to their professional, to their family life. And we're still ensuring that they're getting the highest quality care. And I would argue, because of the ability to do that without the limitations from sort of a geographic perspective, we're providing even better care to these communities than we were before. Other examples where we've seen that is with our pediatric specialists, and many of their existing patients are now being able to be seen as well through those telemedicine modes and being able to have access to that care. Sanford's evidence-based virtual OB for those low-risk pregnancies. Now, many of those visits are able to happen virtually instead of having to travel in and to come there to be seen in person for a short 15-minute visit. Again, saving time, saving money for these individuals, and at the end of the day, providing them with world-class care that they perhaps did not have access to historically. And then, of course, one of the major areas that we in the industry and just really around the country and world have talked a lot about these last couple of years, but I don't think we can talk about it enough, is what it's been able to do from a behavioral health perspective. And we know, unfortunately, across the world, and especially for us in rural America, there are significant shortages when it comes to access to the appropriate behavioral health. And what we've been able to see, again, with that increased adoption, both on the provider and the patient side, individuals now receiving access to care from a behavioral health perspective much more often with fewer barriers than ever before. And we know that there's still, unfortunately, stigma that's out there. There's a number of challenges and hurdles that are in our way to getting the right behavioral care at the right time to the people who need it most. And so I've been pleased with those advancements, but we have a long ways to go and a lot of work to be done. But I've been excited about what that's meant and about what that impact has been able to do for us. As we've looked around, the opportunities to be able to partner with those in industry have been fantastic. TytoCare, we've had a partnership with them since 2018, and really a direct-to-consumer relationship that was enabled by that relationship with TytoCare. And that's been another one, as you heard Dedi talk about, that's really allowed us, again, to allow people to access world-class care, to do so from the comfort and the convenience of their home for themselves and for their families. And so I always look at those situations to say, there's a handful of those that might not have seen any care at all, but for having been able to access us that way. And so that's really what we need to be able to do, that we're committing ourselves to being able to reach those who aren't yet reached today, and be able to do that in a way in which we can create a relationship with these individuals that ensures that they don't have to go without. Nobody should be in a position where they don't have that access to care. And if we don't commit ourselves to it, if we don't focus on that, nobody else is going to. And so we have, I think in many situations, an obligation, a responsibility to do that. I'd say a moral imperative to make sure that we do everything we can to leverage the technology that's out there today to meet those needs.
Recording in progress.
Thank you, Bill. And Dedi, are you still with us? Are you still able to hear us okay?
Yeah, I hear you well, and sorry about that. I had some difficulties, but I hope you hear me fine.
You sound great. So I wanted to follow up, and thank you again, Bill, for that response. Dedi, with your years of experience in the healthcare tech space, can you give us your perspective on trends in the industry with respect to virtual care and technology?
Sure, Emily, and really going for a second back to the what Bill mentioned about COVID, and just to give my perspective on pre and post COVID, we see few major changes besides the basic awareness and the shift forward. We obviously see a lot of payers and providers, mostly in the US, but also outside, embracing virtual solutions and do it in a big way. It became, I would say, a basic practice of care. It's not anymore a future direction. It's here and now. And as many people said, the train has left the station. We are, as Bill mentioned, probably 5 or more years in advance. And the major changes that we've seen post-COVID are two main areas. One is that care used to be in a virtual way only for urgent care. So when the clinic is closed, over the weekends and things of that sort, to overflow when there's a lack of clinician. Today, we see much more of holistic care. So prevention, wellness visits, we do that a lot. We see not only urgent care, but also primary care and chronic management, and all the way to very or more unique use cases of post-discharge and home hospitalization that is emerging in the US. All of that Tyto can really support in a unique way. And this is This is for us very exciting. I think the second part, which is a big change, and I think Sanford has a tremendous forward-thinking approach and unique positioning, is that telehealth is today, or virtual care is not only done with the help desk model of few clinicians in a specific location to do all the care. We see more and more shift to the providers in the community. We see it a lot with the need in Medicaid population, when they usually get used to talk mostly with their own PCP in the community, if possible. But we see it also in terms of value and in terms of results. Utilization of virtual care and engagement and the trust that consumers put in branded organization like Sanford is by far higher than just a doc in the cloud, if you may say. So the shift towards that approach, we see it across the board, also with large payers that are not sufficient anymore with the general telehealth service line, but really want to utilize the clinicians in the community and really empower them with digital tool to elevate the face-to-face interaction. In Tyto, just to conclude that point, part of the change that we bring to the market is where we see a combination of working with your provider, with branded quality provider groups like in Sanford, and with Tyto as the tool to really replicate the face-to-face interaction and really do a physical exam and proper diagnosis to many more types of conditions and many more types of patients, not only for the urgent care. We see an uptick of 5 and to sometimes 8 times higher utilization and a good utilization. When I talk about utilization, I mean when we really can replace and replicate a face-to-face interaction, but do it in a virtual way. So you don't need to go to the clinic. You are eliminating the need to go to the urgent care, to the ER. And all of those visits or interactions that are now shifting to digital are actually providing a lower cost of care without degrading the clinical value and the quality of the care.
Thank you, Dedi, for that. And I'm seeing some good questions coming through. So please continue to add your questions and we will go through these at the end of the session. In this next section, I would love to drill down a little bit deeper into the digital solutions that are effectively addressing access to care. And you've both started to speak to this somewhat in your responses to the earlier questions. But Dedi, perhaps you'd like to drill down into this a little bit more detail and start with broad information about how TytoCare is specifically impacting rural healthcare. You had mentioned there were some global communities where TytoCare is providing that access to care. So if you could just touch on that in a bit more detail. And Dedi, it looks like you're on mute.
Okay, sorry about that. Yes, so thank you, Emily. To just drill down a bit on this topic, I think what is the main gap to really provide quality care in a virtual way is to really being able to replicate what is a physician is normally doing in a clinic, in a visit. And as I said earlier, Tyto, I think for the first time brings that ability not only to do this connection and the virtual interaction, but also to allow physical exam of the throat, the ear, the skin, auscultation of the heart, the lungs, the stomach, and basic vital signs like heart rate, temperature, spirometry, and so forth. So we build the basic platform to enable the basic services, urgent care and primary care for families, adults, and pediatric, And this is the basic solution for the home. Bill mentioned the direct-to-consumer approach, but we usually work not only in that model, but also by defining the right cohort of patient, people who are either really remote or have difficulties for access of care, families with multiple kids, people who are, have a need to see in a higher frequency a clinician. And those are the ones that initially starting to get the service by health systems or by payers around the country. Certainly on the health equity side, we do a lot of work more and more with Medicaid population. And again, as I mentioned earlier, young moms, how to treat young babies and so forth. And today I would say on that approach, Tyto is elevating the tools to not only do urgent care and primary care, but also to look at longitudinal care. So the way we are shifting care, as we shift care to the home, the need around the family primary care is also to treat more fragile population, whether they are chronic patients. Our expertise today that we have just launched recently, and we are increasingly growing in the market, is how to treat in an effective way respiratory diseases, so asthma and COPD, but again, in a very unique way that really elevates the capabilities of, you still have the urgent care, primary care services, but you elevate that with a protocol-based solution and care management, care protocol that is defined with our health systems to really manage those patients. We are planning to add more and more capabilities, care models to a more fragile population, more complex ones. The next one will be around, is coming now around hypertension, young moms, to manage babies over the course of the first 3 to 5 years in an effective way, and really do all those scheduled visits, and most of them or many of them remotely from home, and these kind of things. The second part, which is not related to home specifically, is, as I mentioned earlier, the community-based healthcare. So today, Tyto allows a organization like Sanford to have a hub and spoke model when their high-quality clinician and experts from the main office or the main clinics can serve remote schools, remote homes with elderly population and visiting nurses, remote clinics in rural location or employee work sites, and so forth. So those are the basic tools that we use today, and I will touch maybe later some of the more advanced things that we're planning to do in the future. Thank you.
Thank you, Dedi. And with that overview, Bill, I'd love to turn it over to you. As you mentioned, TytoCare and Sanford Health have been working together for several years now. Sanford Health is TytoCare's first partner to roll out our solution in rural areas. So would love to get your take on the impact that TytoCare as well as other technologies have had on the rural communities that Sanford Health serves.
Absolutely. Just to sort of stand on the shoulders of Dedi's comments, we had a fantastic opportunity to partner with TytoCare and really to help be that solution as a direct-to-consumer, to be able to meet some of those needs, and to partner with TytoCare and the incredible technology that they have has been a real blessing to us, but mostly to the patients we've had the opportunity to serve. And that partnership dates back to 2018, when we had an opportunity to begin to use that. And as we look forward, and as I talk about even the virtual care center that we are breaking ground on next month that we discussed, it's really a great model as we go forward, to have sort of that digital hub, if you will, and then to be able to extend from there into these rural communities. And the way in which we've envisioned that, the way in which we intend to leverage that technology is, of course, the opportunities to be direct to home, where and when we can. But one of the other things that we're doing as a part of that virtual care initiative is also installing, we'll start with 5 in some rural communities that we've identified, where we'll also have a hub there. We'll have some basic lab and imaging. We'll have either technician or a nurse who's there that will help interface with that patient on the other side and have them come in there, and then we'll be able to access them, be able to provide that care and have that connectivity into the virtual care center so that they can have that direct access with that physician, with that advanced practice provider. And as we continue to look at that, we're going to continue to make sure that it's not just sort of a one solution fits all. As Dedi talked about, there are many different opportunities. There's different things that we're looking to be able to treat differently in the future. And of course, want to continue to improve access to primary care. We know it's so incredibly important, but we also want to make sure that we're doing everything we can to leverage that technology to do a better job of managing chronic disease, care at home, to make sure that we're doing those things there from a remote patient monitoring. All of those different areas are opportunities for us to be able to extend, to take and learn from what we've done thus far. And again, be able to continue to bring more and more complex care closer and closer to people so that they don't have to travel, so that we can begin to remove and to tear down more and more of those barriers, whether they be financial, whether they be travel logistics, whether they be timing logistics, to be able to meet the needs. And it's by partnering in industry and partnering outside industry to do that, we believe is going to allow us to be able to meet those needs in a much more sustainable way as we look into the future.
And shifting gears a bit from a technology focused, Bill, at this point, can you speak about Sanford's top rural health legislative priorities at the federal level? Talk to me a bit about the importance of telehealth reimbursement.
It's going to be a critical component to that sustainability side on the provider, as well as from a digital tech perspective. And one of, again, the things that we've seen as a part of that catalyzing moment with COVID, we also saw some things happen on both a state and a federal level that really opened wide the door for us to do everything that we could without the barriers of reimbursement to be able to meet those needs. And so one of the areas that we will look to and are continuing to work on and partner with others right now is as it relates to those waivers. And so those are temporary at this point in time. We would look to try and make those permanent, and so that we could do a better job of being able to access and to be able to meet those needs. Other things that we're looking for as well is when it comes to interstate licensure. That's another area that right now, if we don't have that on a permanent basis, that's going to necessarily continue to create some challenges around access and around making sure that we can extend the right care to give access to the right providers to be able to meet those needs. And really, when it comes to sort of the reimbursement side of it globally, the best way I think I could say is that we really need to get ourselves from a government payer perspective to a commercial payer perspective to a place where we can start receiving reimbursement for outcomes as opposed to the manner in which that care is delivered. And a lot of our efforts and our energies are really focused on that. We believe that as we get to a solution there, that's going to be the right solution for everybody. And again, we have to always keep our eye on making sure that whatever we're doing is in the best interest of our patients. And I believe, as I know most do in the industry with me as well, that by being able to do those things, be able to make some of the things that are temporary permanent now, and be able to get to that more value-based formula, we're going to do what's in the best interest of those patients, and it's going to allow us to really capitalize on the opportunities in front of us, capitalize on the technology and that momentum that we have moving forward right now. And so that would be maybe the best way that I would summarize that as we look to sort of both on a state and a federal level, as we seek to kind of advance some legislation and some changes in that area.
Thank you. Thanks for that response. And just being cognizant of time here, I definitely want to make sure we leave sufficient time for questions at the end. So we'll ask our final question here, and then shift to some of the great questions that are coming in. So to close off with the roundtable, I would love to just ask you both, as you look to the future, to name one thing that excites you most. And Dedi, we'll start with you first.
Thank you, Emily. Hold on. Yeah, thank you, Emily. You know, there are many things that are happening, but if I need to choose one that I see the entire industry, you know, looking at, but we specifically working very hard and investing a lot into that, is how do we bring power of machine learning and AI to real outcomes and real assistance. So Tyto specifically created a very unique repository that until recently was mostly just the basic tools for clinicians to really do their evaluation and diagnosis as they used to do. But as we are growing, we see the need and the capability to use this data with specialists to really bring the level of diagnosis to a higher level with basic, PCPs in the community. One major area, we are working in multiple directions, but the main ones are around respiratory right now. We work with some of the biggest partners in the industry to really make preventive and analysis of real-time data from the lungs to really see degradation in patient with chronic condition. The focus right now, we will release a version in Q4 and early Q1 around very advanced asthma diagnosis and decision support for clinician. And basically, we are harnessing for the first time real data from real patients to help them to get better analysis even before seeing the clinician, based on a standard protocol that will be defined by the clinical group, but really to elevate the knowledge to the clinician with alerts, decision supports, never to replace the decision-making of a clinician, but just to empower them to get more information. One example is around wheeze detection and crackle detection, things that are very hard to get in a face-to-face interaction when you don't have the time as a clinician. With our capabilities, and AI in general can give you the power to do post-processing, to compare that to your huge database, and to really give insights to clinicians. So AI on real data is a big one for me.
You responded to one of the key questions that had come through around artificial intelligence and decision support. So thank you for touching on that too. Bill, I'll turn it over to you if you'd like to share, one exciting thing as you look to the future.
Yeah, simply stated, what excites me the most right now is today, and each day as we move closer, we're going to be getting nearer and nearer to achieving our goals and our objectives, which, as stated before, is to make certain that we do not allow the zip code of an individual to limit the care that they receive. That because of everything that we're talking about today, all that we imagine and envision for the future, we're going to be getting closer and closer to achieving those goals every day. So what excites me the most is that today we bring world-class care to more people than we did yesterday. And I've got all the faith and all the belief, because of everything that we're discussing here, that we're going to continue to do that. We're going to continue to move that needle closer to making certain that we're bringing that life-saving care and that sustaining care to individuals who deserve it. And they don't have access to it today, and we're going to ensure that they do have access to that tomorrow. And I think, as Dedi said as well before, the technology is fantastic. And as we're seeing, we would not be able to do what we do today without it. But at the core of it, for me, what I'm grateful for every day is the 50,000 caregivers at Sanford Health, those who come in every single day and say, I know how we do it today. I'm not for sure how it's going to be done tomorrow, but I'm committed to doing everything that I can. I'm committed to being there to stand in the gap, to provide care for the patients and the communities that we have the privilege of serving. And so I just want to thank them for what they do. I want to thank them for the incredible care that they receive, or that they deliver every day. Thank you.
And one other interesting question that's come through that I'd love to get both of your takes on. The question is, what's the right mix of physical and virtual, specifically when we're talking about a rural area? Maybe Bill, we'll start with you first.
Yeah, I would say it's depends, which is a very unsatisfying answer. But in many situations, it's very fact specific. And what I mean by that is it's going to depend on how rural that community is And is it a situation where we have a small hospital and we're able to augment the expertise around those caregivers, those providers who provide care there? Is it a community that's smaller and might just have a clinic or a super clinic that we're going to surround and bring some of those capabilities to? Or is it some of the very rural communities I described earlier, where we might just set up a small hub where we have access to be able to meet those needs? And in many instances, as you heard Dedi describe too, it's also going to depend as well on the care that we're providing. And is it primary care? Is it chronic disease management? Are these patients that we're providing care to as their provider? Or is this like at Sanford Health, where we leverage our health plan to be able to meet the needs of our 220,000 members there? And so it can look different in every single way, but I do think it's important always as we talk about that. And so I'm glad that I heard Dedi say it. I'm glad to have an opportunity to mention that again, that still at the heart of it, it's our talented providers. It's making sure that those physicians, those advanced practice providers, those nurses, those technicians are still driving that, but it's how do we augment the work that they're doing? How do we bring that expertise around them that allows them to have a farther reach, that allows them to extend that care and extend that expertise and really leverage only that which they can do. And so for years and years, we've always talked about healthcare. You always want everyone to be able to exercise their abilities and their passions to sort of the top of their license. And technology really allows us to be able to do that, to make sure that those decisions that need to always rest with the expertise of the provider do that, and that everything else that we can help, whether it be through artificial intelligence, whether it be through just the capabilities of extending across hundreds or thousands of miles to bring that talented physician into the home of an individual who's providing care. But that's sort of the best way probably to summarize that at this point in time.
And if I may add regarding the again that topic, the way we see it, first of all, I want to echo on what Bill mentioned. The hybrid model is the right model. So you need to take the decision based on the patient, based on the condition, what's the right way. But for sure, people who think that only digital or virtual technology can solve the issue, I don't believe they are right. The opposite. I believe that at the core there's always the medical service. That's why Tyto as a concept is working with provider groups like Sanford to really empower their clinician and their expertise to bring proper care rural areas and not only rural. So I would say, if I need to paint the way the best healthcare can be given is you have the option as a patient, as a consumer, to see your clinician, your preferred clinician in a physical location, if possible. If needed, you can talk with the same clinician or the same level of service in a digital way. And when both are not available, when it's the middle of the night or the weekend, you still have the option to go through digital to some level of an umbrella service of the urgent care. So basically, we are augmenting and helping to enhance the clinicians in their day-to-day work. And I want really to echo also on the gratitude to the team that are doing the most difficult work and the most important work of giving care. We are just assisting them. And again, today we are fortunate enough to have this ability to do much more with much less in much bigger or longer distances.
Thank you. The next question that's coming through, and this is an interesting one, I'd love if you can both speak to how virtual care is lowering the cost of care. Maybe Dedi, you can speak to this more from a TytoCare perspective. Bill, you can talk more generally about TytoCare or other technologies that are helping to do this. Dedi, maybe we'll start with you first.
Sure, thanks, Emily. We actually, it's a great timing. We just in the last few weeks finished two major studies about cost reduction and about really seeing the impact financially of our solution. We had one study with one of the top insurers in the country, in the US, where we see a decrease of close to 18% in total cost of care, TCC, for the cohort of patients. And these were not chronic patients. These were mainly families with kids, not specifically in rural areas, I must admit, but we really see the connection between engagement and utilization of new technology compared to standard virtual care. And we see the outcome, more of those visits that are shifted from physical to digital actually save money. And again, close to 18%. A second use case was with a large HMO, similar to Sanford. They also have a health plan and have a very large physician group. This is out of the US. And we've seen in adults 21% total cost of care they tested about 100,000 patients with Tyto. So adults showed a 21% cost reduction, and on average, including pediatrics, it was about 12%. We will publish this. It was done with Stanford in the US, the research by a third party, and it's now in peer review. We will publish that soon.
Thank you. And Bill, would love to get your take on virtual care lowering the total cost of care.
Yeah, it's really multifactorial. I mean, it's looking at what does that cost look like from the provider perspective? What does that look like for the payers? But again, importantly, what does that look like as it relates to the patient? And so from our vantage point, even looking at the patient, as discussed previously, it's very multifactorial. But when you think about the opportunity to have access to that expertise, that world-class care, and to do so without having to travel hundreds of miles, as many of the people do in the communities that we serve today at Sanford Health, there's some very obvious cost savings that are associated with that for them. And we see that time and time again. We referenced earlier just through the historical telemedicine ways in which we've delivered care, having saved over 20 million miles of travel for our patients. And as discussed, it's the cost of travel. It's the cost for reliable vehicles. It's what do you do for food and for shelter when you're traveling? And what does that mean from a business interruption as you take time off from work and you have to pull children out of school and those things? And so there's a big savings there. Of course, we all know that a lot of the savings within healthcare, as well as that cost avoidance for some of that care avoidance that would have otherwise taken place. So when we look at the ways in which we've been able to do a better job, and even through some of the pilots that we've run, leveraging that technology in our health plan for our members, the ability to do a better job of managing those chronic illnesses, to do a better job of managing those challenges around behavioral health, all of those have a very significant cost savings. And again, most importantly, it's providing the right care for individuals when they need it and where they need it. That's significant. On the provider side, one of the ways in which it also helps is for us, especially in some of the more rural areas across the upper Midwest, many of those are federally designated provider shortage areas. And so the ability to get physicians into those communities is not only challenging, but can be very costly to be able to get those individuals there. And if you think about the way in which they can have a greater impact by leveraging technology, now instead of serving one community, we have the ability to serve many other communities and be able to meet the needs of those patients who are there. And so it continues to be, again, set aside even the work that we're doing around improving reimbursement and tearing down, some of the challenging barriers that we described earlier around the waivers and around interstate licensure. But even then, it still today provides a cost savings. And again, most importantly, providing better care to our patients when they need it.
Thank you. And thank you both so much. Unfortunately, we are out of time. So I want to thank you both for joining us today. This was a really insightful discussion, and also want to thank those who joined. If there were additional questions that came through, feel free to send those and we can follow up over email privately to respond. But again, thank you, and hope everyone has a great rest of their day.